Good morning. Welcome to another program of Techniques in the Morning. I'm Daniela Mora, and today we are going to have a group discussion about organ trade. Davison, a journalist from the Guardian newspaper, in the article, "In China, criminals feel the kidney donor deficit of 2012, informs that in China, organ agents advertise their services under the slogan, "Donate a kidney, buy the new iPad." Furthermore, these agents can be contacted via Weibo, a popular social network in China similar to Facebook. In addition, Vladimir McKay in the crime of trafficking organs did not emerge because of the business itself, but because of the ever-growing gap between the demand of human organs and the limited supply. Also, the National Bioethics Committee in the article, "Illegal Trafficking of Human Organs from Living Donors," released on June of 2013, highlights that the victims of this crime belong to vulnerable groups such as prisoners sentenced to death and minors who are often abducted for organ removal. In addition, Vladimir McKay, a Belarusian politician, in the article "Trafficking for Human Organs of the Year," says that illegal human trafficking occurs in three different forms. First, human trafficking with the purpose of selling the person and for the extraction of their organs. Second, transplant tourism, which involves traveling mainly to a developing country, and there the tourist undergoes a transplantation of an organ purchased by local donors. Second, finally, the movement of organs themselves from one country to another. Well, now that we are aware that this is a serious issue, we have today a group of experts that will discuss some causes, consequences, and possible solutions for this problem. Let me introduce them to you. Today we have Katarina. She is a patient of the waiting list for a kidney. Jennifer Barantes, our physician. Melissa is a lawyer, and Andrea, an economist. Welcome. Thank you all for coming today. Let's start with you, Katarina. You as a patient, what are the main causes of organ trade?
First of all, thank you for giving me the opportunity to express myself. I think that in this kind of discussions, it is really important to have the opinion of a person who needs an organ. The first cause is that there is an international shortage of organs available for transplantation because the demand is bigger than the supply of organs. Also, there are legal issues regarding the availability of organs because in many countries it is forbidden to buy an organ. So patients have to wait years to obtain one legally. This takes us to the second cause, that is long waiting lists. The National Kidney Foundation establishes that in 2014 there was a list of more than 120,000 patients waiting for a surgery just in the USA. Now imagine how many people around the world are waiting for a surgery. For example, in Costa Rica, there is a list of more than 800 people waiting for a surgery, and we have to take into account that Costa Rica is a really small country, so this is a high number.
Thanks for sharing your perspective, Katarina. Now I would like to hear the medical causes of this problem. Well, what can you tell us about it?
Well, first, thank you so much for inviting me today. Well, talking to health area, I can say that the most relevant causes are, number one, lack of ethical values of physicians, and two, greediness of physicians too. Obviously, the two causes are connected between them. Talking about the first one, lack of ethical values, every day more physicians take part of the black market called organ trade. According to my friends Fabian and Monico, who are doctors from Canada, in their article, Organ Trafficking and Transplant Tourism, a commentary on the global realities, published in the year 2008 in the magazine American Journal of Transplantation, doctors start working in a private and illegal way. The recipients arrive at physicians' offices, and later on, the physicians perform the medical surgery. It is so sad because physicians are forgetting all the ethical values that they learned when they graduated as physicians. And in addition, it is so sad because they are forgetting our main purpose, that is to save human beings. The second cause is greediness of physicians too, because for many physicians, money becomes the only important thing, and for that reason they become criminals. Saveri and Monique mentioned in their article that doctors take advantages of their position and perform the medical surgeries, charging them thousands of dollars.
Thank you, doctor. Andrea, what are the financial causes of this illicit activity?
Good morning, and thank you for inviting me today. From the financial area, I can tell you that in the United Nations General Assembly about illegal organ trade in 2014, it was exposed that poverty is one of the main causes of this issue. For example, in China, Pakistan, and India, poverty has influenced their citizens to get involved into this black market of organs. The main reason is that poverty generates desperation in people, so they consider that selling an organ is a quick way to solve their financial situation. In addition, Usher reveals in the article Body Snatchers Organ Harvesting for Profit, published in 2013, that another cause of this issue is profitability for traffickers. For example, he reports that the price of organs differs in each country. For instance, a kidney in Colombia can cost $80,000, and in South Africa it can cost $120,000. A heart in China can cost $130,000, and in Taiwan the same heart can cost $290,000. And finally, a lung in China can cost $110,000, and in Singapore, it can cost $290,000. So you can see the difference, and the advantage for traffickers is that the necessity of organs will go on.
Thanks for the input, Andrea. But besides the financial and the medical aspect, the law view is also important to analyze why this problem still persists. So, Melissa, you as a lawyer, what is causing the prevalence of this issue?
Oh, good morning. Thank you for the invitation. Well, as an expert in the field of laws, I can say that culprit of this global concern is the fact that the sale of organs is still legal in Iran. So I think that Iran's government must ban this procedure as the United States did in 1984, India's in 1994, and Philippines in 2008. Due to the creation of organ transplant acts, respectively, in these countries, and also the creation of the Declaration of Istanbul. I think that another fact is that China has a policy that allows the collection of organs from executed prisoners. But at least these people signed an agreement previously. In addition, I think that in other countries, as Costa Rica, in the past, the absence of specific laws that regulate organ donation widened the possibility that these crimes occur. Fortunately, that situation has changed, and now we lawyers have two laws that penalize these crimes against humanity. We have the law 1995, the law against human trafficking. It was approved and published by the Legislative Assembly in 2013. And we also have the law 9222, the law of donation and transplant of organs and human tissues, and it was published officially in La Gaceta newspaper last year.
Thank you, Melissa. Well, in summary, our experts just stated that the main causes of organ trade are long waiting lists, limited supply of human organs, corruption of physicians, poverty, business, and very recent laws that definitely need improvement. To continue, we cannot separate the causes of this problem from its consequences, which we are going to develop in the following way. First, Katarina, what are the consequences of this problem according to your perspective?
And the main consequence is the death of sick people because thousands of patients who are on a waiting list are dying because they have to wait years for an urgent surgery, and unfortunately the pain and the illness don't stop during the waiting. The website organdonor.gov establishes that at least 18 people die every single day waiting for transplants that can take place because of the shortage of organs available for transplantation. And actually this number is rising. The second consequence is the low quality of life that patients on a waiting list have, because people on a waiting list become sicker because of the delay of the organ that they need. Also, we have a lot of limits. For example, a person who needs a heart transplant cannot do physical activity. Or in my case, I have a chronic kidney disease and I need a new kidney. I have to go to the hospital several days a week in order to pass through a blood filtering procedure known as dialysis. I've been waiting for this surgery like almost 4 years and a half, and because in Costa Rica there is a list of 141 people waiting for a kidney, and I've been aware of the coordinator of la Unidad de Trasplante del Seguro Social says that kidneys are the most vulnerable organs in the human body, so they have the highest demand. And here I brought a paper from la Caja Costarricense del Seguro Social. It says that my surgery is going to be performed in 2025. Imagine I have to wait 10 years and right now I'm dying.
I'm very sorry to hear about your situation, Katarina. Thanks for sharing that with us. Jennifer, in the medical field, who is more affected by the illegal trafficking of organs?
Well, as Katarina mentioned before, the consequences of the issue do not affect us as doctors, but they affect in a dramatic way our patients. We have two relevant consequences. They are to compromise people's health and their risk of dying, not only for the patient but also for the donor. Again, the two consequences are connected between them. The first consequence, to compromise people's health, happens because doctors are doing this illegal activity as if they were playing a game, and it is so sad and unacceptable too. Taking a fragment of my friend Fabian Monico's article, many patients return home with inadequate reports of operative events. In addition, my co-worker Karen A. Hudson, in her article, Globalization and Black Market Organ Trafficking, when in the kidney campaign that was published in the year 2008, she says that lack of proper medical care will continue to fuel the trading human organs. I agree with them because people suffer the consequences of lack of proper medical care, and in addition, as every illegal activity, this one does not have all the necessary requirements established by laws. The second consequence, the risk of dying not only for the patient but also for the donor, happen because, as Fabian and Monico mentioned in their article, an unknown risk of donor-transmitted illnesses, infections of malignancy, such as hepatitis and tuberculosis, exists due to lack of proper medical care. In my opinion, people die as a result of lack of medicines and therapies.
It's hard to hear all these situations as consequence of lack of medical care. Thank you, doctor. And Andrea, in the economy field, what are some consequences of organ trade and whom is more affected by it?
In fact, Daniela, those who are more affected by this illegal trade are the possible donors. For example, the first consequence for them is limited employability after the removal procedure. As Jennifer mentioned before, an inappropriate procedure and an unsuitable recovery process compromise people's health, so their work opportunities will be limited because most of them are not going to be able to perform certain types of jobs. For example, Elizondo states in the article, The State of International Organ Trade, published in 2007, that 73% of Egyptian donors cannot perform labor-intensive jobs because they had an inappropriate procedure, which and the situation compromise and do not help them to success in the financial way. In addition, fraudulent transactions between traffickers and donors is another consequence for them. Sometimes traffickers take advantage of their position and they treat donors in order to have more profits. For example, in 2012, Perry exposes in the article How Poverty Fell from the Fuel Illegal Organ Trafficking the case of a Bangladeshi that only received $600 instead of $1,200 that were promised before the removal procedure.
That is just unbelievable. Thanks for the information. To continue, Melissa, what are some effects of organ trade from the legal perspective?
I consider that one of the main outcomes for my field is that nowadays fewer people ask lawyers to employ a clause in their last wills that specify that they want to become donors after their deaths. And I think that this is absolutely related to the cases we have heard about in which some surgeons have performed unlawful procedures, even in our public health system. So I think that this is why fewer people are willing to donate their organs or to specify this in their last wills. In addition, I think that nowadays this business is spread all over the world. In fact, my colleague Emily Kelly from the Boston College Law School specifies in her 2013 article, International Organ Trafficking Crisis, that trafficking in organs is growing lucrative enterprise, much like the illicit market for weapons, humans, and drugs. In fact, another colleague, Lindsay Wagner from the University of Utah, also agrees with her and with me at this point. She says in her article, Organ Trafficking, More Than Just a Myth, that published last November, that even though there are some global efforts to fight against this war, the black market of organs is still on the rise.
Thank you, Melissa. It's very important to know everything you just stated. To restate, this part of the conversation highlighted that the main consequences of organ trade are death and low quality life for patients of the waiting lists, more traffickers and less people willing to donate organs, fraudulent transactions, and health risk from both donor and patient. To continue, well, this is a great deal of a problem. I would like to hear the possible solutions that you brought today. Katerina, tell us yours first.
Yes, first of all, we must let people choose if they want either donate or sell their organs, because we are the owners of our bodies, so we can do whatever we want with them. I mean, if I want to sell my kidney or my lung, no one has the right to stop me. This definitely will increase the amount of organs available for transplantation, because on one hand, if a person wants to sell an organ, he or she can do it freely and without being penalized. And on the other hand, patients who are looking for organs can obtain them easily instead of waiting years for an urgent surgery. Also, this will stop the illicit market of organs. The second solution is raising awareness. I think that education is really important if we want to increase the amount of organs available for transplantation. Some of the solutions are using public awareness, such as posters and display boards, also bringing mass media to the matter, and requesting for the help of medical centers to make some propaganda. These solutions will provoke a reaction on the population, so they will help people who need an organ.
Thank you, Katerina. I see your point. Jennifer, what do you propose?
Well, I had two possible solutions. They are first to apply the ethical protocol of the Declaration of Istanbul, and second, the creation of new laws and medical programs based on the first. Well, the Declaration of Istanbul is an ethical protocol that was created in the year 2008 for several countries around the world. According to the decision, Mario Uribe from Chile, the main purpose of the protocol is to regulate the healthcare system in every country. In his article, Declaración de Estambul en relación al tráfico de órganos y turismo en trasplante, published in the year 2009. In addition, to know the protocol should be a requirement for being a physician. As a result, for about more corruption too. And finally, the creation of new programs and laws based on the protocol, because the Declaration of Istanbul suggested many changes in the health system. For example, it proposes the regulation of the process when it involves that something comes from or arrives to other countries, and also to regulation the healthcare services and donation of living and death donors.
Very interesting solutions, doctor. Thank you. Now, Andrea, from your field, what are some possible solutions to stop these black market organs?
Daniela, in the United Nations General Assembly about illegal organ trade in 2014, they proposed that to eliminate poverty is one of the best solutions for this issue. As I explained to you before, this is a huge problem, and it is involving people into this black market of organs. So they proposed that to increase foreign investment in order to create more work opportunities. It will be a helpful tool to eliminate this issue. In addition, financial incentives and tax breaks are two solutions that have been already implemented in other countries and that can be implemented in other countries too. For example, Jafar explains in the article Organ Trafficking Global Solutions for a Global Problem, published in 2009, that the Iran's government implemented and regulated and compensated organ kidney transplantation. And it consists of offering $1,200 to those who wants to sell a kidney. Also, they offering a post-transplant care, as you can see here. And then, in 2013, Kelly points out, quote unquote, in the article International Organ Trafficking Crisis Solutions, addressing the head of the matter, the Wisconsin initiative of a tax deduction up to $10,000 to cover expenses associated with organ donation. Those expenses, yes, include travel, lodging, and lost wages.
Thank you, Andrea. Melissa, what does the law field proposes to stop this problem?
Well, as this is a worldwide reality, I think that all countries must improve the current laws that regulate organ donation to avoid more cases of organ trading. As I mentioned before, now in Costa Rica we have two laws. In the fifth article of the law 1995 that I mentioned, well, it states that it's mentioned between the definition of human trade. Organ trade is mentioned as part of human trade, and more specifically in Law 9222, that it's related to donation and transplantation. It's stated in the Article 59 that people who sell, buy, own, or transport or deliver organs will be punished with jail from 8 to 16 years. And also, I think that the creation of these two laws reflect our strong attempt to fight against this problem, because nowadays it's really serious here. And also, I think that we need the cooperation among nations. We also require the intervention of global authorities and the cooperation of non-governmental organizations. Because up to now, the United Nations Convention Against Transnational Organized Crime, the Palermo Protocol, the United Nations Global Initiative to Fight Human Trafficking have helped, but we need to keep the hard work, because if not, this war will never end.
Thank you, Melissa. To conclude with this section of solutions, our participants proposed free will of letting people choose if they want to donate or sell their organs, also raising awareness, implementing the Protocol of Istanbul and the new programs of medical treatments, financial incentives and tax breaks, and finally, our lawyer proposed implementing stronger laws and making easier the intervention of global authorities. Well, as far as I'm concerned, and after all you told me today, I have to say that the best solution for this problem is a combination of education, raising awareness, and implementing new laws, or stronger laws, to fight against this problem, because we cannot work isolated from in one solution if we do not work in the other aspects that are failing in creating this problem. Now, to summarize this meeting, we discussed that there are several different causes, consequences, and possible solutions to stop this black market of organs. And remember, how much are you worth? Humans are not for sale. A not for sale organization, 2013. Thank you so much for coming today and participating, and thank you for listening to our great discussion. Finally, our experts are willing to answer any question that you may have. Is there any question?
Thank you.